What makes children's UTIs resistant to antibiotics? Imagine a tiny army of bacteria causing infections in a child's urinary tract. Some of these bacteria have learned how to dodge the medicines meant to kill them. That's what makes some urinary tract infections in children resistant to antibiotics. The main bacteria involved is Escherichia coli, or E. coli, which causes about 85 to 90% of these infections. Other bacteria like Klebsiella, Enterobacter, and Proteus can also be involved, but E. coli is the most common. Over time, these bacteria have developed ways to survive even when antibiotics are used. They do this by changing their structure or producing special enzymes that break down the medicines. One big reason for resistance is how antibiotics are used. Sometimes, antibiotics are given when they are not needed, or the wrong type or dose is used. This can happen when doctors start treatment before they get lab results showing exactly which bacteria are causing the infection. If antibiotics are used too often or improperly, bacteria can learn to resist them. Children who get antibiotics regularly to prevent infections, especially those with recurring urinary tract infections or structural issues in their urinary system, are more likely to develop resistant bacteria. This is because the bacteria are exposed to antibiotics repeatedly, giving them more chances to adapt. Another factor is the presence of bacteria that produce special enzymes called extended-spectrum beta-lactamases, or ESBLs. These enzymes can break down many common antibiotics like penicillins and cephalosporins, making these drugs ineffective. Some bacteria can even resist multiple types of antibiotics at once, which is called multidrug resistance. About 1/3 of resistant bacteria in children with urinary tract infections are multidrug resistant. This is especially common in children with urinary tract abnormalities or structural problems. The level of resistance can also depend on where the child lives. In some countries, especially those with less regulation of antibiotic sales, resistance rates tend to be higher. When antibiotics are easily available without a prescription, they are more likely to be misused, which speeds up resistance. Even in developed countries, resistance remains a concern, with many bacteria showing resistance to common antibiotics like cotrimoxazole and trimethoprim. Because of this growing resistance, doctors may find that usual first-choice antibiotics do not work as well anymore. Instead, they might need to choose other medicines that are less affected by resistance, such as nitrofurantoin, amikacin, carbapenems, or fosfomycin. These drugs are often used for more complicated or serious infections in children. It is very important for healthcare providers to base antibiotic choices on local resistance patterns and to use laboratory tests to identify the specific bacteria causing the infection. In summary, children's urinary tract infections become resistant to antibiotics mainly because of the widespread presence of bacteria like E. coli that have learned to survive these medicines. Overuse and misuse of antibiotics, especially in children with recurrent infections or urinary abnormalities, also play a big role. The spread of bacteria that produce enzymes like ESBLs and multidrug-resistant strains makes treatment more challenging. To combat this, healthcare providers emphasize careful use of antibiotics, proper testing, and monitoring local resistance trends to ensure children get the most effective treatment. Always remember, if a child has a urinary tract infection, it is essential to consult a healthcare professional for proper diagnosis and treatment tailored to their specific situation.